you don't have a bum shoulder or a bad knee or a bad insert body part here. You have your body is made to take on load. Hey everybody, this is Jamie Applegate from Inside Track Physical Therapy and Wellness here with our staff, and this is our first video that we are posting as a long form, so be nice to us. Okay, so today we want to start doing these weekly, and the purpose of these is that we want to start talking about different topics, about patients that we treat and see and problems that we treat and see, highlights for the week. And then we also want to spend time answering your questions and doing this live, so that way you guys can reliably find us on Friday afternoons around lunchtime, and you can just pop on and give us some questions. So we are not set up for that today because this is our first one. So we're going to just talk about a couple topics that we discussed and found throughout the week, and we're just going to talk about them here. So introduce yourselves, ladies. My name is Dr. Jamie Raystack Applegate. I am a doctor of physical therapy and have my dry needling certification, and I do sports rehab.
I'm Dr. Jana Yoder, and I am here at Inside Track Physical Therapy and Wellness, and I am a sports rehab physical therapist, dry needling certified.
My name is Dr. Haley Brown. I am also dry needling certified and do sports rehab.
So what I want to start with, this is supposed to be pretty relaxed. What I want to start with today is just talking about what was a good thing that we had this week that you guys enjoyed this week, whether it's kind of like the good things we do at our all hands meeting, what was good this week. So I'll go first so you guys have some time to think. My good thing this week was, it was a very busy week, to be honest. It's a little tougher week, but I did stick to my schedule of ending the day at 5 every day and going home and seeing my daughter and my husband. So I did not work past 5, which for those of you that may know me, that can be very difficult for me. So that was my good thing.
I had my second big workout. I just started CrossFit workouts, and it was a lot of fun, even if it was challenging. And I'm a little sore today.
This week, was a very busy week, but I still made time to get to the gym and do my rehab, just like hopefully all of you guys do. Doesn't always happen. No one's perfect, but this week I was able to do that, so that felt good.
Mm-hmm. All right. So what we're going to talk about today is a post that I made 2 weeks ago, and Facebook and Instagram took it like a champ, but TikTok blew up in a negative way about it. And so I wanted to talk a little bit about it with you guys, with some of the patients that we see and some of the things that we treat people for and some of the mindset that we deal with, not just the rehab, the exercises, the manual work, the dry needling, the blood flow restriction training can all play a part in what we do. But mindset is a big thing I think that we work on with our patients. And the post was, for those of you who haven't seen it, it basically was me. It was a little 10-second clip of me just trying to connect with people more. And one of the things I said was, you don't have a bum shoulder or a bad knee or a bad insert body part here. You have your body is made to take on load. It is made to take on weightlifting. And TikTok got really negative about it, to be completely honest. But a lot of the negative comments were pretty much people just talking about how in pain they were. I basically had 90 comments of people who could have been patients of ours, because it was well, tell that to my torn ACL, tell that to my torn meniscus, tell that to my 2 herniated discs in my back that I ended up getting a fusion for. Those are patients that we see all the time. And a lot of them do come in with that mindset when we first see them of what's your main goal while you're here? Well, I want to be able to just be out of pain when I'm taking stairs or getting up and down off the ground or something. And they end much further than that goal, much more beyond that goal than when they start. But the mindset when they first start is all very similar. I have a bad whatever. And so I wanted to talk about that a little bit with you guys. So when you see patients, when we all see patients, I want to just talk about that. How does that go with when you hear someone say yeah, I want to get out of pain, you're searching for more goals. How does that process go for you? And how do you help them see, oh yeah, there could be more to this, or we could do more than this, even though they're starting from a point of I may never be able to achieve this again.
I think sometimes we do just have to start small, and if they can only think about their pain and getting out of pain, I start trying to ask, well, why do you want to be out of pain? Which feels like a stupid question, but then they usually start thinking about, oh, well, that'll allow me to do this, or that'll allow me to go do this, and not be in pain and not struggle through something that they really enjoy. Or it's kind of like a daily task that they don't think about they've just been used to compensating and going through it in pain, but thinking about, oh, well, if I could do this little thing pain-free, that would add value to my life, because then I could do this activity or this activity, and then they kind of start thinking bigger. But sometimes we just have to help them progress those small thoughts and embrace the small thoughts before moving into bigger thoughts.
Yeah, and I'm just trying to collect my thoughts as you were talking, but some people come in and be like, for a knee issue, and say, well, I've got this shoulder thing, but it's not a problem. I just work at it. And we get talking, and it's like, well, it is really limiting them, and they didn't realize they could change that because they've tried other things and just hasn't worked. And then when you dig in and you're like, this is actually something you can work on and get better with it, then so don't give up on your body part that you want to be able to move, or you don't think you can.
Well, and like, can you guys think of a couple scenarios? Like, I have a couple, but I don't want to be the only one talking. But I have a couple of like patients. So without giving up patient information, so like change the story. Like we always say, this is our HIPAA statement. We are not going to talk about real patients on this list. We are always going to change something. If it's a he, it might be a she. If they play baseball, it might be softball. Like, it's just the way it is. But talk about like a scenario where you were talking through a goal with someone. Like you were talking through like it could have been the first session, or it could have been as they were progressing. And I'll start. I had someone yesterday talk about, because I brought this up with them, and they were like, they were just like, yeah, that's an interesting concept that people were so upset about that, but it makes sense. And then not 5 minutes later, we were doing back squat, and they were like, oh yeah, this bad leg. And like, even that, I was like, why'd you call it that? Like, it's not, and we even learned that in PT school, right? Like we learn like, you want to call it like the opposite side, the affected side, the surgical side, which seems really stupid. And at the time I was like, I don't want to do that. That just seems excessive and like dumb. But like, it's so connected to our mindset. I was talking about this with the patient, like when we're going through the process of therapy, like let's take an ACL tear and repair, for example. Let's say it's an ACL repair with a meniscus repair, which is like a super common surgery that we see. That person is going to be told what they can't do, and they're not going to be able to use that. So they're going to get that reinforcement also for like 2 straight months. And then it's like, okay, now you can do this, but now you can walk and you can put weight through it, but you cannot bend the knee. Okay, now it's 4 weeks later. Okay, you can bend your knee. Do not bend it past 90. Otherwise, like your knee is going to fall apart. It's broken, right? Like they're constantly reinforced with these mindset shifts of like, you have to do all these, you can't do. And then in traditional therapy, which we don't do anymore, you get to a certain point and then it's like, okay, that's all we can do. But they're never shown like what they could do. And then add 2 decades to that of like movements reinforcing that you still can't do it. And then pain reinforcing you still can't do it. And then people being like, oh, should I drive for you or take you somewhere? Or you can't lift this heavy thing, let me do it for you. You're just constantly told like, I can't. Where like some people may come here and it's the first time they're being told like, why can't you deadlift 100 pounds? And they're like, I can't even pick up a bag of salt. And it's like, right. So if we want to do that, right? Like, I don't know. What are your thoughts on that? Because like, that's something that like I started thinking about a whole lot. But I just, that comment, that TikTok just made me think about how many people are so in pain and how ingrained we are in telling them what they can't do. So how do you guys, like, what I usually do with my patients is now I'm like, just after that, starting to recognize how they're talking about themselves even more. And like I said, like I was talking with that patient and immediately, it was like 5 minutes later, they're like, oh, my bad leg. Don't call it that. That's Gary now. That's your Gary leg. It's fine. Call it literally anything else.
Gary.
Your Gary leg. Why not?
Oh my goodness.
I'm trying to think. I mean, I've had some people lately come in for one thing, but like, well, I have this other thing going on. I had surgery on it. And I'm still doing some activity, but I'm not really, I'm not lifting, I'm not doing anything to strengthen it. And so it just becomes that leg if you're not testing it more than outside of what are managing. So for example, if you're like playing pickleball, and you can do all of those things, but you are still having pain with it, and just accepting that, there's more that can be done. And being able to talking to this person, I think we've gotten on the same page now, and we're still in the early rehab with it, but we'll be able to get into some more heavier lifting, and I think that's going to make the big difference because it has with other patients.
I have a patient in particular that comes to mind. He has had low back pain and sciatic, symptom referral into his legs on and off for about 10 years. It would come on and then go away, and this most recent flare-up has just been really bad, so that's what brought him in to see us. His activity levels have been really low because every time he's tried to do something, it like flares him up. He couldn't walk for like 3 minutes without needing to, stop and take a break. So we were trying to get out of the mindset of like, again, kind of what Jamie said, it hurts me to do these things, so I shouldn't do them, but just progressively kind of loading him up with a squat, increasing his core strength. And over these last couple of visits, we've made a ton of progress just showing him that he can do those movements and pick up some weights. And he went from being able to tolerate walking, 3 minutes, and now he can do 10 minutes, which is a huge step in his progress. And his goal is to be able to walk around Disney for a vacation with his family coming up here pretty soon. So I think he's on track, and it's really exciting to see that he will hopefully be able to do that. So.
Yeah. Well, and that also makes me think of a couple other questions. I was like, as you guys were talking, so like the first time you're going to have a patient pick up weight, because we lift a lot of weights around here. So like the first time you're going to have someone pick up a dumbbell or pick up a barbell, do you get resistance with that with some of your patients when you're like designing some of that stuff, especially some people that like they've got the mindset like, oh, I'll never be able to do this thing. Like when you have them do that, like, are they nervous? Do you follow up with them the next day and be like, so how's the shoulder? Like, how do you handle that? Like, I'm thinking for me in particular, like when I first put a weight in a patient's hand, like after a surgery or after they have had chronic pain for 20 years and they can't even walk without pain. And then I'm like, all right, we're going to lift this 20-pound weight off the floor right now. And they're like, but bending over hurts. And I'm like, it used to. So I'm thinking about like one person in particular I have who we've been working on some stuff, and they're still a little resistant. Like we're still working on some of that mindset stuff because they haven't kind of gotten there, but we've been able to like they've had chronic pain for to be fair, they've had chronic pain for almost 20 years. So like the first day I had them deadlift anything, it was off a chair, and we just like bent down almost like we were going to do like a sumo and picked it up and then went back down. And they had a little pain the next day, and we had to talk about like soreness versus like the actual pain they've been having.
That's what I was going to say. Yeah. Distinguishing soreness and teaching difference between pain levels and soreness. Yeah.
Yes. Yeah. So I'm wondering, like, I guess that gets into my actual question, which is like, how do you teach people, like when they have flare-ups? We have patients that have flare-ups all the time. How do you teach them like the difference between an injury or just being hurt? Because they are different. Like, what do you guys see?
Something important that I try to educate my patients on, especially ones in chronic pain or having really high levels of pain, when we're exercising, trying to keep pain levels at an X out of 10 level during that. And then also just asking them questions to determine whether or not it is like their true pain. Is this the same thing you were feeling before you came in here? Is this like, tell me how it feels. Is it here? Is it in a different spot? How long does it last? Usually we can then distinguish between, oh, this is just muscle soreness. This is going to go away. We want this to last for however many days. Not days. We don't want soreness to last that long. But if it is lasting that long.
PSA, if your DOMS is lasting a week, it's too long.
No, that's bad. Usually I'd like, sometimes after someone lifts for the first time, like that patient I was talking about, he was sore for about 3 days, but we were able to distinguish that, okay, this is soreness. And he was kind of excited about it. He's like, oh, I'm sore from lifting weights. And I don't know, it was just a really good thing for him to like show him and for him to see for himself that he could do those things and not have a pain flare up, but like the soreness is okay. And sometimes what we want.
Right.
Yeah.
So I'm thinking of somebody, I was just trying to kind of get it together if it applies or not, but who would be like, well, it hurts to do that. I'm like, okay, but what kind of pain is that in the moment even, not just after? And he's like, well, it's kind of like my pain. And they're like, well, I'll do it if you want me to work through it. And so also educating on like, okay, you can.
Oh my God, no
I
pain,
want
no
you to
gain.
the no pain, no gain thing.
Kill me.
So if
Always,
you're
not
doing it,
always.
if you're doing a movement, and it's like she said, Haley said a X out of 10, like set a level that is reasonable. A lot of times like 2 or 3. And if you're going beyond that with a exercise, then you probably gonna not go or you're probably gonna hurt. You might hurt. Whereas if you're keeping it there, you might feel sore. And then in addition to that, if you're doing things, a lot of times I have a conversation with somebody like, well, it hurts, I'm not gonna do it. But you're doing a whole lot more outside here than you are here. So if you're lifting, if you're doing this activity,
Give an
and
example. 'Cause yes.
if you
Yes.
are
Yes.
lifting, if let's say you're a farmer and you lift a hay bale 100 times,
Like it's harvest season and you're
Because
lifting 100 square bales.
and you say, well, and you're like, well, it hurts. Well, you're lifting an amount of weight that's quite impressive. You could be lifting some other amount of weight here, and it not hurt in the same way because you're doing. Yeah. Anyways, you're moving better. And then, so it's not a reason not to lift heavy.
Yeah.
It's just you have to be aware of your limitation on.
And usually it's a
Repetitions.
form issue.
Yes.
Like patients come in all the time and they tell me, this exercise felt good, this one felt good, I really like that one, but that one, oh my gosh, it hurt me so bad. And I'm like, we're gonna review that and make sure. And then
Let's break that down.
8.5 times out of 10, they have some wonky form and aren't doing it correctly at all, which that's partially, if not mostly, on me for not making sure that they know how to do it before I send it to them. But usually correcting form too can make such a difference. They're like, I'm doing this exercise, I'm lifting this, and it like you told me, but it's hurting me now. Well, their form's not correct. So
Well, and let's also be clear. Sometimes you give someone something and you have shown them how to do it and they come back and it's not
True.
what you showed them.
True.
And we do our best to make sure that doesn't
No.
happen. But
yeah, yep.
yeah, and that actually gets into like a deeper question also, like when we're talking about like a bad body part, like I have bad insert body part here. When we're talking about like I want to talk about a couple examples where it's like this body part hurts me, but then they explain the thing that they're doing. Like you bring up farmers just killed me. Like farmers, y'all, it's some of the time when you come in with things, it's like, we could have taken care of this a long time ago. Like, back in 92, when you pulled it the first time, we could have taken care of it. Like,
Well, we couldn't have because we weren't alive. But
maybe not me. The profession. We could have done something. But, like, I'm thinking of, like I always think of like our higher performing athletes. We see a lot of high performing athletes here, but I also think of some of our people who like they just want to enjoy their hobbies. They want to do yard work. They want to be able to garden. They want to like get up and down off the ground with their kids.
Yeah.
Y'all know how many people just can't even get up off the ground to play with their grandkids and their kids? Y'all. Actually, this is interesting. I don't know if you guys have experienced this at all, but like 2 of the healthiest populations I've ever met in my entire life in the profession are Muslims and Amish. And the reason is because Muslims pray 5 times a day, and they're getting up and down off the ground 5 times a day. Like, I've seen 90-year-old ladies come in here, and I'm like, do a lunge. And they're like, I'm like, holy crap. And then the Amish just never stop moving.
Yeah.
Like, they're always outside. They're always biking.
Yeah.
This is not me supporting any religious affiliation. I'm just saying those are the 2 populations that I've seen that are absolutely, as they age, the best shape. Because they're just constantly doing those activities. Constantly. But, like, when they come in, they're like, I just have this little bit of pain right here. And I'm like, yes, wow, you're 80. And like, it's just right here. And they're like, well, yeah, I have soreness like a couple other places. But like this one's like a 5 out of 10. It's a little bit sharper. It's just always interesting when they talk about that kind of stuff. So, but do you have examples of that where you've like met with people and they've said something and you're like, wow, like you see them come in, like I'm thinking of a couple patients that I know you guys have that they come in and you're like, that's all you got? Like based on like what they enjoy doing and like what they're having pain with. And that doesn't diminish what they're coming in to do. And these are people, like I would say, who wouldn't say like, I have a bad body part, or they're like categorizing it that way, but they can tell like, oh, the rest of these things are just like, I'm hurting, but this is like an injury, and how they define it. Because some of our highest performers, like they can really tell the difference.
Yeah.
So I'm wondering, like, can you give like a HIPAA appropriate example of a couple of these people that you see?
I'm not gonna lie, I thought I was following you with that question, but I think I kind of lost you like halfway through, because I had someone in mind and then I was like, oh, that doesn't
tell me
fit
your
anymore.
thing. Tell me
No,
your thing.
I mean, I guess you're gonna know who this is right away, but I
Yes.
have this patient who is like 80. Is she 80?
We're gonna say she's 100.
Okay, she's old. And every time she comes in to see me, and she's very active. She goes on vacations all the time and is able to travel, takes workout classes, can get up and down off the ground, can do stairs, and she just has a few like nagging things that she is very, very focused on. But yeah, it's just so impressive that she can do what she's able to do at her age. And, you know, at this point, there's a lot of things that we can't prevent with natural, you know, age is a factor, especially once you get past a certain point. You know, progress is going to be maybe slower. Are we going to be able to heal as quickly as like a 30-year-old? No. But the way that she's just able to maintain her function and, you know, still focus on these things, but just never has had like any surgeries, any back pain.
Well, and she's progressing.
Yeah.
Like she's
And
getting
still-
better.
yeah.
It's just slow because
Yeah.
like she's older and your body's
Yes.
just not going to be as
Yeah.
efficient. But she's patient with it. She's
Yeah.
like, I'm still making progress.
Yeah.
Like she lived in New Zealand for a month,
Yeah. Yeah. So
like last year.
Yeah. Yeah. And she's, not as young as some of our other patients, but she's just as active and is killing it.
Goals.
Yeah. Yeah.
Straight up goals.
Yeah.
Yes.
So I don't think that answers the question, but she was someone that I thought about originally when I thought the question was going a different direction. So.
But that's what I want is like the patients that like, I guess that's better is like, as we're talking about, like she's one, she can tell the difference between like, this is an injury and this is just,
Right.
I'm a little sore. I'm hurting, but I'm not, this is
Right.
not an injury. And that did relate to the question. I just
Yeah.
am a long question asker.
No, it's okay.
And this isn't in particular with any one person, and yeah, it's more of a general. So like, I've had several patients come in, and their bodies just move in a way that I'm not like it should hurt, or you look at them and say that should hurt.
I'm going to be honest. We
And it
call these
doesn't.
people motor morons. We do.
Well,
We're all
what I'm
laughing. We
thinking-
don't ever say it to their face.
So actually, this
Well, you'll never know if your PT thinks you're a motor moron. Not ever.
I don't know. I might tell you.
I'm thinking
Depends what level of friendship we're on. Patient to PT relationship.
Yeah.
now I'm thinking like a really really arthritic knee that like they're stepping. They're not a motor moron. It's just like it moves. It's like it's not in a straight line. There, it's not where you expect the knee to really be positionally. And I've had several where like it doesn't really hurt.
Yeah.
It hurts a little, but they can do all the things. They're like, I've been walking on it for years like this, and I'm okay. And so it's always, that's always a surprise to me sometimes. So maybe off topic, but what you have going on doesn't always mean there's pain with that. So think about it in different ways.
Well, yeah, like let's also talk about like we don't have to rant on this too long. I could rant on this for hours, but like the gaslighting of it's bone on bone.
I had
I've
a
seen
patient
it.
say that this week, and
It looks like it.
It's
And it
bone
doesn't
on
always
bone.
hurt.
Where's my big red button in the lights? What?
call the ambulance, call the hospital.
Okay, that seems insensitive.
Yeah, that was me. I'm sorry.
I'm sorry. The reason it makes us laugh to hear that out loud is that exactly to your point, your story. They come in, they're walking all wonky, and like that knee has arthritic rub, and you can feel the pieces of bone and the spurs just like grinding next to each other, but they don't have any pain. They can take stairs and squat. They can play with their kids, like their grandkids. They can pick up the salt bags and like take them to the stairs. Like
Or maybe they're here because it doesn't hurt, but they just can't do it.
right. Like they
I
haven't
mean-
figured out how to do the thing, even though it's not painful.
Yeah.
Yes. And don't get me wrong, like there's a lot of factors that go into bone on bone. Like you can still have pain when it's bone on bone and you need a joint replacement. That's absolutely possible. But let's be real, like we overprescribe joint replacements. We just say like you have bone on bone, there's an x-ray right there that shows it, check, mark, get into surgery. Like that just happens so commonly. And it's usually the default answer when people are like, oh yeah, like it's bone on bone though.
Yeah.
Cool. You know what's side rant? Actually, like in the same lane, but like side rant. I want to see in the comments, what is arthritis? I ask every single patient I talk to if they can explain to me what arthritis actually is and what does bone on bone actually mean. Don't say anything. We'll talk about it next week and we'll dive a little deeper into it. But like, that's what I want to hear from people is like, give me your best description without looking
I was
on
gonna say,
Google
don't Google it.
or ChatGPT.
Nobody likes a cheater.
Right. Don't give away the answer. But like, think about like what arthritis actually is and what bone on bone actually means. It's hurt. We hear it all the time. All of us have heard it from someone, and that's okay. Don't get me wrong. Some people need surgery. Some people need an injection. We don't lean on exercise enough for that problem, which is why we laughed when we were talking about that because, and we'll make this our last thing. People have a very low belief in like what they can do to change their situation. Like when they have a physical injury. We're not gonna get into other things like comorbidities, mental stuff, like that's not our realm. But when it comes to like their physical body and being capable of doing things, like they have a low bar for how much like just wellness changes can change how much they can move and do things. So like, let's just stick with the knee arthritis example. Actually, let's do hip arthritis because it's a little more complex of a joint. But like, what does the research show on like exercise, sleep, hydration, stress management, load management on recovery from exercise in the majority of the population with arthritis that we know of? We don't need to pull out specific statistics if you don't have it off the dome. We don't have to be like this article at all. Like, we could search them and we could talk about them and maybe we will one day, but we're not doing that today. I'm putting us on the spot. So like, what do we know that we talk to our patients about every day that's just that? Like managing hip arthritis with wellness tactics and like what you can do for yourself.
I think a lot of the time, the simple broad answer is training the muscles to absorb the forces that they're not right now. So all the stress that goes through your body when you're standing, sitting, it hurts the joint because the muscles aren't doing what they're supposed to be doing and taking on that load. So I think people think that they shouldn't be doing those things because it hurts, but it's like if we train your muscles to be strong enough to absorb those things, then that's less pressure, less force on the joint, and can just feel really good. And relieve. I shouldn't say feel really good, but make progress towards those things and increasing activity.
Yeah. Yeah, I would say there's a lot of research out there, a lot of different articles. Like I said, I can go search them and find them if people are like really dying to read some research. have fun. But there's a lot of research out there that shows like the more we strengthen muscles, that strengthens ligaments, tendons, bones, especially like our menopausal women. So that way that joint doesn't have to take on that stress. That joint's only job is to be a hinge for the body to move around. The muscles are what are actually supposed to be doing that work. And the ligaments, the tendons, the joint, the nervous system takes on that load if the muscles aren't doing their job. Mm-hmm. And so weight training for arthritis is very important. And a lot of people deviate the other direction because they're like, oh, I can't handle that or I can't do that. But it's because they haven't broken down those movements to their like supplemental parts to be able to progress them and add load. And that's what we do. Is like we teach people how to break those things down and then turn them into more complex movements so that way they can take them into what we would call functional activities, but just stuff around the house or stuff at work or stuff in the yard, like, or on the basketball court. Like we take all of those and we put them back into like a frame of reference that the patient can work from. And you'll think about it tomorrow.
Jana will submit her answer tomorrow
in the comments. Okay, well, let's end today because we got to head out. We're already over and we shouldn't be because this was my first time. Go team. Happy Halloween. We are.
Can you guess what we are?
I didn't say it. Yeah. Also comment. What are we wearing? What are we dressed as? But
Not obvious.
yeah, it's not.
If you couldn't guess and you need another hint, our front desk, Adriana, had a wild card on her shirt.
So now you have details. But yes, we are. We hope you have a happy Halloween. We hope that we'll start seeing you guys on these Friday interviews. Basically, we're gonna do these with our staff. We're gonna do these with patients who want to come talk about their story. We're gonna do this with other partners that we connect with well in the community that talk about things that we support. So that could be registered dietitians, could be doctors, could be chiros, could be strength and conditioning coaches, could be weight training classes. I mean, we're open to all of it. And honestly, if you've got some people that you would like us to interview and talk about with, we're going to be doing these live. I am not opposed to talking live and being challenged live. So give me a good one. I'm going to.
I might be opposed, but I'm trying.
Just like bye.
Jana and I are a little opposed, but we're listening to our boss and trying to embrace it.
The interviews with you guys will be easier, and today wasn't too bad. Like
No, it
if
was
we had
good.
been
This was
live, it
fine.
would have been just fine.
Yeah.
So
Yeah.
anyhow, this is what we're gonna do on Fridays, except on Fridays where we are all out of the office. It is a holiday. That's gonna be pretty much the only ones where we're not gonna be available. So the other days of the week we'll be here. We're gonna figure out our sign off at some point. I don't have one right now. Go team. Bye.
Bye.
Get on the right track with Inside
Oh,
Track.
God.
It can't be that.